Hi, I'm Bob Hasegawa, State Senator for the 11th Legislative District, and wanted to welcome you all to the Healthcare Town Hall. And I was asked to talk a little bit about my Washington Whole Health Trust bill, which is actually a universal health care bill that is in the Senate, but it's not moving. And cutoff is next week, so it's not likely to move. The chair has not scheduled it for hearing. But we all know how important it is for everybody to have health care coverage, especially in the middle of a pandemic. It's just like one of those no-brainer things that we should be doing. We should have done already, actually. And we've seen the disparate impacts that coronavirus and COVID is having in our communities of color and lower income communities. And so the lack of healthcare is also having a disproportionate impact, negative impact in our communities. So this bill would have dealt with that. Unfortunately, it wasn't able to get a hearing. There's also this issue about the distribution of vaccines and the strategy that the Department of Health is using to get the vaccines out into the communities. And I noted, I met with some of our community healthcare clinics last week, and they were telling me they didn't even get an allocation of vaccines last week because they all went to the hospitals. So as an afterthought, they may have been able to scrounge some vaccines, some doses from the hospitals themselves, but that's a problem in the strategy that the Department of Health is using, because we know that our communities are disproportionately impacted by COVID. And that's where the vaccines, if they're really trying to fend off the pandemic, is where they should be focusing their resources. So if you want to weigh in with the Department of Health, there should be a contact website where you can fill out a form and let them know that they need to focus a lot of their distribution on our most adversely affected communities. So at any rate, just wanted to welcome you all and thank you for having this conversation. It's a very important conversation right now about healthcare. And also want to wish you a happy Lunar New Year. All right. So anyway, you're the ox. And I'm sorry that our celebrations this year are not going to be what we're normally accustomed to this time of year, but it is what it is. Shigatakanai is what we would say in Japanese. But anyway, okay. Happy Lunar New Year and have a great town hall. Thanks.